thank you very much. As Gwendolyn said, my name is Connell Foley. I'm Head of Strategy, Advocacy and Learning at Concern Worldwide, which is an international NGO based in Ireland. We have offices here in New York and Chicago, as well as in London, working in about 23 countries around the world since 1968. What I'm really going to talk to you about today is I'm going to talk to you about learning and lessons that we have learned. I think it's a story that I'm really going to talk about, a very practical story, and why I think that we found that the concept of resilience is useful to us. And that's essentially the story I want to talk about. So I'm going to talk about 3 countries, learning from work we've done in Niger, in Ethiopia, in Kenya, and then I'm going to talk about how we're actually applying it with a new program in Chad. So as you can see, again, we're talking really about the Sahel and the Horn of Africa. And to me, when I start thinking about chronic food insecurity, they're exactly the contexts that come up in my head. Regular droughts, desertification, environmental issues, poor capacity, conflict, etc. So let me start with Niger. We've conducted operational research, and we've had a number of researchers come to us to offer their services, a number of them from Tufts, over 3 hunger seasons between 2010 and 2012 in the Tahoe region, where we've been working for about 10 years. A lot of the research is really focused around cash transfers, where we give people money to get them through the hunger season. We found, and the research found, that the cash transfer actually has led to more frequent, or they do lead to more frequent meals for children and more legume consumption, which is always a bit of an assumption and we worry about it. So a large portion of cash transfers is actually spent on household food, which is a very positive thing. I think what's interesting is around, in terms of improving or maintaining nutritional status, then cash transfers alone or with community management of acute malnutrition are not enough, and they need to be integrated with other interventions that actually address the causes of malnutrition and food insecurity. So again, what we found we were doing on an annual basis is actually treating nutrition or preventing it in that kind of close to end stage. Nutrition food and food security indicators like number of hunger days or dietary diversity scores or GAM rates, for example, should be monitored to account for cash transfers' many uses and to measure the nutritional success of the program. Again, I think people give cash transfers and sometimes assume that there are nutritional benefits from them when we know that they can be used for a whole variety of reasons, not least of which would be health and education of children. So there were just some of the findings from some of those operational research. In terms of the learning we took from that, in a sense, we felt that cash transfers and nutrition treatment programs that focused on seasonal hunger needs were insufficient to create resilience to periodic hunger crisis. So they were too short-term in their thinking, which has always been a problem we've had, and there are funding reasons for that also. Also, we think that longer-term development interventions focused on building absorptive and adaptive coping strategies would be required. So we needed to be thinking much longer-term if we were seriously going to build resilience. Independently, because we actually allow our country teams to analyse their own context and design programmes there, our Ethiopia team has been dealing with this issue, as you can imagine, since the early 80s. We've been working in South Wallo Zone, where the stunting rate is actually very high, much higher than the national average. The Warada, where we work in Desazuria, is chronically food insecure, so 40% dependent on safety nets. The GAM rate was reduced only once to less than 10% in the last 10 years. And now there's a high dependence on the Productive Safety Net program, which is the Ethiopian government program most of you will be familiar with, which I think basically provides social protection to 7 to 9 million people annually, around 13% of the population. The kinds of coping mechanisms our target group would actually have would be obviously reliance on PSNP, so in terms of social protection, begging, eating unpalatable wild fruits, daily labour. So the livelihoods are very vulnerable to risks and shocks, as you can imagine, due to climate variability, regular droughts, human and livestock diseases, pests, flooding and landslides, stuff that you all know already. And I suppose in a sense we've been dealing with this for many years, and I think the real issue has been we've been doing humanitarian responses, we've been doing development work. We're really not bringing them together sufficiently well. I think that's really what the essence of this is. What we've been doing over the last number of years really has been trying to build resilience using multisectoral interventions, so things like land and water management, watershed management, bringing frost-tolerant crops in the highlands, because these are very high areas in northern Ethiopia. So we've been bringing potato in, for example, as a way of diversifying from teff and maize. So crop diversification, increasing maintaining livestock assets, improving water and sanitation, and then early identification of malnutrition and having a CMAM response to that. We've also been complementing the Productive Safety Nets program by including fresh food vouchers, so that we're trying to get good diet to children and, who need it during the hunger season. And we're also doing a lot of work supporting the local health system with infant and young child feeding as well. The learning from Ethiopia, in a sense of the things that we feel are working, are basically using multi-sectoral approach to maximize the linkages between sectors. So, you know, we know that just doing one sector generally doesn't build much resilience. We work with existing institutions coordination to promote a sense of ownership. So we need to get both communities and government built into this, so it's not just seen as an NGO-centered approach. We're actually mapping real-time resilience outcomes to create some kind of evidence for policy change, and also to convince the Ethiopian government that they need to do more about maximizing the linkages between sectors. And I was actually there last November, and I was quite struck at Warada and Kebele level, talking with government officials about how they were bought into things like the costed nutrition plans, for example, and that sense of addressing stunting in a coordinated way. We found that we need to address the environmental drivers of risk using DRR technologies and practices, so like watershed management, addressing environmental issues, addressing gender issues that are critical, because we know again that women are disproportionately affected by shocks. We need to also create contingency plans, so defining a surge capacity. I'll come back to this again, to help respond to small-scale disasters or provide initial response to large-scale disasters. Derek, I think, referred to the FuseNet or the early warning systems that are in place already. I think we have a strong sense from our disaster risk reduction work that early warning systems are actually quite good for NGOs and for government at a high level, but not so good for communities. And, you know, again, it's trying to get communities to analyse their own risks and put contingency plans for themselves in place. Again, supporting local government early warning systems and, you know, making sure that food security is not threatened by the cumulative effects of lesser shocks or stressors. I think, again, one of the findings from the Sahel over the last number of years has been that food production and availability, I think, was actually wasn't as bad as we thought between 2010 and 2011. But what had happened to create a major problem was that people's assets had been eroded over many years, and suddenly there was an impact in relation to that. Let me move on to Kenya. I think this map, I hope, tells quite a lot. The map on your left shows the situation in 2010. And given that this is web streamed, I'm not sure if I can move from the podium. But this is the area of Mayala where we're working. And if you look at it in terms of the GAM rates in 2010 and then the GAM rates in 2011, you will see that all of the districts around it, the GAM rates have shot up, but it has remained stable in Mayale. So there they are. In fact, both GAM and SAM, we showed significant improvements, or let's say a better situation than in the other districts. So for GAM, for example, you know, it was a marginal increase compared to a fairly significant increase in Marsabit and Wajir North. And in terms of SAM, we actually reduced the rate while it significantly increased in the others. So in terms of that, you know, that sense of extreme hunger or famine in 2011, we saw that the interventions that we were doing actually made a difference. And what were those interventions that kind of created a sense of resilience to that drought, or that the accumulation of 3 out of 5 years of drought? They were livelihoods and water interventions, so things like introducing dryland farming alongside pastoralism, you know, bringing different types of crops to the diet, such as kale, onion, tomatoes, and fruits. We brought drought-tolerant species in. We helped improve irrigation systems, diversified livestock, so moving people from cattle to camels, for example. Worked on rangeland management, worked with local communities on conflict mitigation and pasture access, and improved access to water to make sure that for pastoralists that their animals actually had access to water over a longer time through the year. We also, at the same time, strengthened government capacity to respond to nutritional crisis. Very much a health system strengthening approach, where we did technical support training to the staff. We looked at quality of care oversight systems, a lot of very much strong management issues, but also this issue of surging up. When there was a spike in malnutrition, helping the government health system to be able to cope with the increased caseload. And I'll talk a little bit about that again in a second. And then early scaling up of high-impact nutrition interventions when the warning bells rang. We also did work then coordination between the Kenyan government, WFP and World Vision, who were actually providing safety nets at the time in terms of cash transfers. So again, the lessons were that strengthening of resilience at community level, using contextually appropriate, and that's actually really important because every country is different. The types of interventions you'll require will be different depending on the context. And multisectoral interventions actually worked. It did seem to create some level of resistance to a spike in malnutrition, if you want to call that resilience, and I think that's how we interpret it. Strengthening government capacity to respond to a nutritional emergency, such as this surge capacity model, then early scaling up of high impact interventions and coordination. If I just go on to this idea of a surge capacity, I think this is really important. Most NGOs who are working with local government health departments are interested in what we call health system strengthening. So it is around making sure that the system itself is increasing its capacity. And you're putting that, those efforts in over a 10 or 15 year period. What happens, of course, is when caseloads spike, whether they be diarrhea or malaria or malnutrition in some cases, or SAM, then they need external support. And in a sense, we've been working on this model where you identify triggers in terms of the caseload where you actually need external assistance. So you can scale up external assistance, and then you can scale it back down when the caseloads reduce. And I think this is quite an interesting and exciting area to look at. So my final couple of slides before the recommendations are the learning we took from Niger, Ethiopia, and Kenya, we're now applying in Chad. And basically, we have designed a randomized controlled trial, which has been supported, the research is being supported by the Feinstein International Center at Tufts University. And it does involve control groups and treatment groups. And what we have is we have a package to build community resilience. And in normal years with no shocks, we would expect improved health, nutrition, livelihood security for the rural population. But we recognize that within a 4-year period, we may get 2 or 3 years where we have significant drought. And if thresholds are passed, we will actually do an emergency response, both in the control and treatment areas. So you're trying to look at the longer term as well as respond to the early warning systems with some early action. Again, I've got a 2-minute warning from Gwendolyn, so I better move through this. It's a full package of multi-sectoral interventions. I won't go through the details, but there's quite a lot of them. Again, what we're quite clear is what we're trying to achieve in relation to this. And that is, if you like, a narrowing of the hunger gap over a period of time. So we are going to compare the treatment group with the control group in terms of nutrition rates, malnutrition rates, beg your pardon. So just the conclusions, I think for us, this is the last slide here before I go on to recommendations. The guiding principles for resilience building, we feel, are undertaking systematic risk analysis, reducing cause of vulnerability by building assets and supporting sustainable livelihoods, which is stuff we've been trying to do for a long time, addressing drivers of inequality, building up communities' absorptive and adaptive capacities, including better access to safety nets and deepening or diversifying livelihoods, supporting enhanced capacity for effective and timely emergency responses, and building institutions for governance and risk management at the local level in particular. That's why we focus very much at community resilience. So that's the concern example over. Sorry, Gwendolyn, I'm going slightly over. I have 3 slides on recommendations in the Global Hunger Index. Just want to say first is, I suppose, resilience is not a panacea. I think it's much more important, resilience particularly to food crisis is particularly important in particular contexts where particular risks pertain. We had a lot of discussions about these recommendations, and we decided we would make recommendations for the international development humanitarian donor communities, as well as country governments, as well as people like ourselves, NGOs. And they weren't easy recommendations to make, in fact. For the international development humanitarian donor communities, these are the kinds of things we think are important, and a lot of them are actually happening at the moment. So breaking down the institutional, financial and conceptual walls separating development and humanitarian assistance in donor and UN agencies. Second one, supporting a coordinated approach to monitoring resilience building measures and building an evidence based on the impact and effectiveness of such measures. Derek talked a little bit about this already, about the need to measure resilience, to know what kinds of measures we're looking at. And I think there's a lot of work to be done on that. But certainly we feel that there's potential to do much better data collection, more frequent data collection in high burden areas, and in sentinel sites and utilising those more effectively. And the last then is obviously focusing on a pro-poor resilience approach. That is really making sure that we're focused on the poorest and that their resilience is being built and not just at a wider system level, although that's important. For country level, for governments, if you like, or country level policy makers, some of these are similar, but applied at a national level. So developing national approaches to food and nutrition security that are resilient to shocks and other stresses. In many ways, for those of you who are familiar with SUN and the real huge leadership and commitment there is now to scaling up nutrition, in many ways it's around, if you like, disaster proofing costed SUN plans. I think that would be a very practical step in relation to this. Encouraging, facilitating a multisectoral approach to resilience, coordinating plans and programs across line ministries. Not easy, I'm sure you'll have questions about that. And then evaluating national sector strategies and action plans to using disaster proofing and resilience building lenses. And the final slide then just is, we do recognise ourselves that we need to change, even in concern. I know we were quite siloed for years between our humanitarian and our development work, and we also need to change our own practice. I think that's happening gradually. So again, we need to focus on improving maternal and child nutrition in developing regions with interventions to address the immediate and underlying causes of undernutrition. We need to support positive coping mechanisms that people already use, such as community-level savings networks, banks, insurance. There are a whole range of them. And again, I think for NGOs and our national partners, we should be using our long-term experience in development programming to lobby for resilience-enhancing policy change. I think that's it.